Picture this. You're reaching for a painkiller, and a pill slips from your hand, bouncing across the floor. Before you can even bend down, your dog snatches it up and swallows it. Or maybe your cat, curious as ever, licks a little bit of medicated cream you just applied. It happens in a flash, but the consequences can be devastating. A single human pill, something that helps us feel better, can be life-threatening for our furry best friends, even in the smallest dose. In today's video, we're going to cover crucial, life-saving information. You'll learn exactly what to do the moment it happens, which common medicines are the most deadly for your pets, when you should absolutely not try to make them vomit, and the steps you can take to save your pet's life. This is one of those videos that could truly make a difference, so please, watch until the very end. It might just help you save a life. Okay, so the worst has happened. You saw your pet eat a human pill. The first and most important step is to stay calm and act fast. I know your heart is probably pounding, but panicking will only waste precious time. You cannot afford to wait and see if symptoms develop. Time is absolutely critical here. For most poisonings, the medicine starts getting absorbed into their system and becomes dangerous within just 30 to 60 minutes. Every second counts. Step 2, while staying calm, is to secure the area and figure out exactly what was eaten. Immediately get your pet away from the source of the medicine. If there are other pills on the floor, pick them all up. Then, like a detective, gather the evidence. You need to check the bottle or package for the medicine's name, its strength in milligrams, like 200 milligrams, or 500 milligrams, or 500 milligrams, and try to figure out the quantity that's missing. How many pills did they actually eat? Also, make a note of the time. Knowing when they ingested it is vital for the vet. Here's a really important tip. For some medications, especially with cats, even one single pill can be fatal, so don't ever assume a small amount is okay. Now for step 3, and this is a big one. Never ever give home remedies. I see this online all the time, people suggesting you should give your pet milk, or lemon water, or even salt water to make them throw up. Please don't do this. Things like activated charcoal should only be given under direct veterinary instruction. Googling for remedies in a panic can lead you to advice that makes the poisoning much worse. These so-called cures can cause more harm, like aspiration, pneumonia, or salt toxicity. Just don't do it. Your vet is the only source of truth in this emergency. Let's move on to step 4. Identifying the most dangerous human medicines. This is the stuff you need to be extra careful with. At the top of the list are painkillers. These are extremely deadly for pets. Common ones like ibuprofen, which you know as Advil or Motrin, and paracetamol or acetaminophen, known as Tylenol, are incredibly toxic. Paracetamol is particularly deadly for cats. Even aspirin can be very dangerous. These drugs can cause severe internal bleeding, kidney failure, and catastrophic liver damage. Next up are antidepressants. Medications like Prozac or Zoloft can cause serious neurological problems in pets, leading to tremors, seizures, extreme anxiety, and dangerous heart problems. Then we have cold and flu medicines. The decongestants found in many of these products, like pseudoephedrine, are highly toxic even in very small doses. Cough syrups can also contain ingredients that are harmful to pets. Always keep these locked away. Finally, be aware of heart and blood pressure medications. Things like beta blockers and ACE inhibitors are designed to have a powerful effect on the cardiovascular system. In a pet, they can cause a sudden, drastic drop in blood pressure, leading to weakness and collapse. So, if you or anyone in your home takes these types of medications, you have to be vigilant. This brings us to the most critical action, step 5. Call for emergency help immediately. Do not delay. Do not wait and see. You need to call your local emergency vet clinic right away. If you're in the US, you can also call the Pet Poison Helpline or the ASPCA Animal Poison Control Center. We'll have their numbers on the screen and in the description below. When you call, be prepared to give them all the information you gathered. Tell them your pet's breed and approximate weight, the exact name of the medicine and the strength, how much they ingested, and the time they ate it. Also, let them know if you're seeing any symptoms, even if they seem mild. They will give you the precise instructions you need to follow. They might tell you to rush to the clinic immediately or guide you on the next steps. Follow their advice to the letter. Now, you might be wondering, should I make my pet vomit? This is step 6, and it's a question the professionals need to answer, not you. Do not induce vomiting unless you are explicitly told to do so by a vet or a poison control expert. There are situations where making a pet vomit is extremely dangerous. For example, if your pet is already groggy, unconscious, or having seizures, they could choke on their own vomit. You also shouldn't induce vomiting if they swallowed something corrosive that could burn their esophagus on the way back up, or if they swallowed extended release pills, as vomiting might not even be effective. The decision to induce vomiting is a medical one, and it must be made by a vet who can weigh the risks and benefits. Step 7 is to watch for symptoms, both on the way to the vet and in the hours that follow. Some warning signs of poisoning include vomiting or diarrhea, excessive drooling, muscle tremors or seizures, extreme tiredness or lethargy, a sudden loss of appetite, difficulty breathing, or pale gums. It's important to know that symptoms might not appear right away. They can be delayed by several hours, but the internal damage is already happening. That's why waiting for symptoms to appear before calling for help is such a dangerous mistake. Finally, let's talk about the best step of all. Step 8. Prevention. As the old saying goes, prevention is always better than cure, and it's 1,000 times easier than dealing with a poisoning emergency. First, store all your medicines, both prescription and over-the-counter, in secure, preferably locked, cabinets that your pets absolutely cannot access. Remember, some cats are masters at opening cupboards. Never leave pills out on countertops, bedside tables, or in your purse or backpack on the floor. It's just too easy for a curious pet to get into them. A pill bottle can look like a fun new chew toy to a dog. A huge rule to live by: do not ever give your pet any human medication without explicit approval and dosage instructions from your veterinarian. Their bodies are not the same as ours, and what's safe for you can be deadly for them. It can also be helpful to train your pets, especially dogs, a strong leave at command. This can be a lifesaver if you drop a pill or any other dangerous item on the floor. And lastly, make sure everyone in your household, including kids and visitors, understands these rules. A little education can prevent a tragic accident. Your pet's safety is in your hands. Taking these simple preventative steps can save you and your beloved companion from a heartbreaking and costly emergency. Thank you so much for watching. If this video helped you or you think it could help someone you know, please give it a like and share it with other pet owners. And do want to get to subscribe to Pet Health and Care for more essential tips on keeping your furry family members safe and healthy. Because at the end of the day, your pet depends on you.